Work is underway on a new study using Sudbury's vertigo risk score. Researchers are hoping to create a reliable tool that improves patient care. It's all thanks to a grant worth more than $750,000 from the Canada Institutes of Health Research. CTV's Madison Marier reports.
The risk score provides questions for physicians to ask in order to determine the immediate risk of reported dizziness. Dr. Robert Ole is hoping to use Sudbury's vertigo risk score to better understand quicker and convenient treatments for patients in emergency settings.
Dizziness is a really common complaint in the emergency department. And it's tough for emergency medicine physicians because we don't have great guidance on deciding of those patients that present who is suffering from a serious diagnosis and who is safe to be discharged home.
The Sudbury Vertigo Risk Score is currently being tested to validate the effectiveness for emergency physicians to identify high-risk dizziness patients. The funding is also improving NOSM students' learning about very common emergency department patients. Dr. Michael Green said in the release, when research, teaching, and clinical practice come together, patients, especially those in rural and northern communities, see the direct benefit. Dr. Ole says the data is important to Northern Ontario, as in Southern Ontario populations, referrals are more convenient than in the north.
Northern Ontario, patients oftentimes have to travel long distance to see specialists. So referring them to somebody has a big impact on the patient. So it's more important than ever for us to be able to accurately identify who actually needs to make that trip to see the neurologist, who needs to be transferred to a center to have advanced imaging.
According to HSN, most cases of dizziness are benign. However, some dizziness can be a sign of life-threatening conditions. Madison Marier, CTV News, Sudbury.